The Sustainable Development Goals are a blueprint for peace and prosperity, shared by all countries in a global partnership. Together, Albertans across the province are making progress toward the goals.
We're very lucky we live in Canada where healthcare is available to everybody. But what I see is the best scenario is when people have adequate education of what's available.
Our mission is wellness for individuals and communities affected by HIV through education and prevention and supporting them.
For us to arrive at zero, particularly in HIV, we can only get there through education. But as we are right now, we're still struggling with it. 40 million people globally are living with HIV and 50% are on treatment. In African communities, we are carrying the biggest burden of HIV. Some of the outreach that I do in African communities, we give education in churches, faith groups, and also in barbershops. Good morning. My name is Sipiwe. I come here quite often. I've seen this brother before to do presentation on HIV and AIDS. We found that it's very difficult to get African men together to talk about HIV and anything sex. Drumbeat goes to the barbershops where they are. It's a safe space for black men. What I want you to feel right now is it's a conversation. I'm not going to be preaching, but I want us to talk about HIV and what it looks like in our African black communities. It's more than just having their hair cut. They talk about a lot of social issues and personal issues as brothers. So we have what we call brothers chats, which is informal conversation, talk about HIV, testing transmission, treatment, and also stigma, what it looks like. People are still stuck in the old thinking of HIV that if one is HIV positive, they've got AIDS. And the difference between those two is quite clear. Information is not easily accessible to everybody. And also services are not the same in every community. In order to have health equalities in HIV and ACB communities, we'd like to see testing become the norm, and those who are HIV positive to be linked to treatment and care as soon as possible. The education that we give is quite empowering because they come to us and they are really torn. They have nowhere to go, they have no support, and they just don't see the future in there. When you see somebody who was totally devastated and you see them 6-7 months later into their treatment and they're feeling a bit better and knowing that they're not alone in this journey, it fills my heart.